Hello, are you there? No. If we can, let me go to Susan. Susan, good morning.
Good morning, Doctor.
Good morning. So, you're in Scarborough.
I am.
Are people isolating in Scarborough?
Well, from what we've heard today, it's been a gorgeous day. And some of us who are staying in know this. A lot of my neighbours and friends and a lot of this community are self-isolating. When I say that, I mean, do I need to go to the shop? No. I potter around in my garden, it's doing the house, and North Yorkshire, like, they're at the beaches, they've been in the park.
Wow.
There are some people are actually reporting they've had the highest great sales, and it nearly made me physically sick to think it's arrogance.
But why is it, do you think, that people... that's the word that's been in my head. Actually, arrogance.
This is not funny, Petrie. There are too many people. I can stay in, you can stay in, we can all be sensible. There are people, children, who are really ill. And I'm staying in to help to save a life.
Yeah, well, I saw... Yeah, we've all got to... But it's also to save the NHS, isn't it? It's to...
But I've got two daughters, Petrie, who are on the front line. I would have said exactly the same thing. One's a nurse, she's right in it. My other daughter, my youngest, is a health worker. They both work in the local hospitals. They haven't got the proper equipment yet. These people have no choice. And the other key workers. Now, I'm doing this, and my friends, and my neighbours, because we want to help people. Don't get me wrong, people, I don't want it. But the arrogance, we can walk out and do it when all this is over, which it will do. We are healthy enough, God forbid. We will walk again. There's children who can't breathe. There are people who are really, really will not get this illness. And it's just the same in North Yorkshire as it is in London. And I think there should be a lockdown.
That's really interesting to me, Susan, because I thought that it was just London, because the images that we're seeing is it's Londoners going to the markets and wandering around the parks, but it's all over the place.
The beaches, packed. Scarborough, North Bay and South Bay. There are, in the countryside, because we're lucky enough to have the beach at 5 minutes this way, and the countryside here. Cars, hundreds of cars, parked along the lanes in the country. Ice cream vans jingling. Some companies, to repeat, they're reporting really high figures. In sales, I don't know how they're there.
But are you scared of Londoners? Because we're the sort of epicentre of it. We've got the most cases. Do you think that Londoners should be banned from leaving London?
Well, it's like having children. You ask them nicely, this is dangerous, you can't run across the road. Now, if you ignore that, I'm going to have to get serious. This is not funny. Nobody comes in the country unless they have to. Nobody goes out.
Yeah. No, I hear you. I absolutely hear you, and that is the truth, isn't it? That we need to be. If we don't do it nicely, if we don't do what we're asked to do, we will be told to do it. So I want to hear from you. I'm really surprised to hear from Susan that Scarborough is exactly the same as it is in London. That people are sort of ignoring the advice at the moment. It's advice, but many people suggesting that Boris Johnson is going to get tougher, and in fact himself suggested yesterday in his press conference he is going to have to get tougher. At the moment he's relying on us to behave sensibly. He's relying on us. I've been hearing from young people that they're having parties and raves and getting together with a sort of, stuffed coronavirus type vibe, or words to that effect. So, an 18-year-old has just died. I mean, these people are not immune. So I want to hear from you this morning. Give me a call, wherever you are in the country, wherever you are now. We've got the whole country listening. I want to hear you. I want to hear what you're up to, what's happening. Are you isolating? Are you social distancing? Are other people doing the same thing? Because it doesn't make any difference if it's only a handful of us that are actually doing it. 0800 731 2000. Just before I return to the calls, people have been advised not to travel to second homes or camp and caravan sites across the UK as efforts to continue to limit the spread of the virus. Ministers say that anything other than essential travel is putting additional pressure on communities and services already under strain. And that's the question I wanted to ask you this morning, is about Londoners going to their second homes or Londoners leaving London. We are, unfortunately, at the epicentre of this virus at the moment. Do you want us to not move around? Lads, Boris, so I want you to call me on that. Jason Rosman is here with more. Jason, good morning. Last night,
Morning, Petrie.
Boris Johnson said further measures.
That's right, and this emergency legislation that would grant powers aimed at tackling the spread of the pandemic is going to be debated by MPs in the House of Commons later. And under these proposals, airports could be shut, police would be able to force people with virus symptoms to isolate. The powers, which would be time limited for 2 years, are expected to be approved by MPs today. And as you said, Boris Johnson warning new stricter antivirus measures could soon be introduced. Yesterday, he threatened those further measures to limit people's movement if they continue to ignore formal guidance on social distancing.
We've all seen how people have been enjoying themselves over a beautiful weekend. My message is you've got to follow the social distancing rule. Otherwise, if you don't do it responsibly, if people don't exercise responsibly, then there is going to be no doubt that we will have to bring forward further measures, and we are certainly keeping that under constant review.
And that emergency legislation includes enabling recently retired NHS staff to return to work without any negative impact on their pensions. Also fast-tracking funeral arrangements, allowing more court hearings to take place by phone or video. But most controversially, Petrie, the bill gives unprecedented powers to law enforcement agencies to detain people if they show symptoms of the virus and put them in appropriate isolation facilities.
There's already been one arrest, hasn't there? I think on the Isle of Man.
Has there?
Yeah.
I haven't heard about that.
Yeah, last week.
Well, the bill says this will help to safeguard essential services that could be at risk during the outbreak. Martin McKee is a professor of European Public Health at the London School of Hygiene and Tropical Medicine. He thinks a tougher crackdown can't come soon enough.
We need to act quickly, and that's why I and many other colleagues have been on telephone conferences all day today, and there is a very clear consensus among us that, first of all, the lockdown is the first thing that we need to do, but we need to go further than that, and that we need to continue what the government is working very hard on doing, which is greatly ramping up the testing capacity, and there are major constraints in our ability to do that.
Well, the NHS has announced it's identified that 1.5 million of the population most at risk, so people who should now stay at home for 12 weeks. Letters should be dropping through letterboxes today on that. Those at risk people include those with specific cancers, severe respiratory conditions, people who've received organ transplants as well. And the government is setting up hubs. This is what we heard from the press conference last night. And these hubs will be around the country, and they will arrange deliveries of groceries and medicines to those at-risk people. So councils, pharmacists, members of the armed forces will help with this work. There'll be opportunities for members of the public to volunteer. Health Secretary Matt Hancock says he's determined to get the right personal protective equipment to the right people. This is a mammoth task, but we're hearing from hospitals all over the country saying they just don't have the right levels of protective equipment. The NHS staff dealing with the outbreaks are complaining that they just don't have enough. 1 million extra face masks are being sent out from today. Some workers say having the right kit is just one of the issues they're facing. Claire Taylor's a GP based in Balham in South London.
You have a plastic apron, gloves and a simple surgical mask. There's questions about how adequate that is when in a room, a small room, with a patient who is found to be positive and is coughing. We have had our staff decimated due to both the isolation guidance, but particularly the pregnancy guidance, which obviously we're following. None of our pregnant colleagues can see patients face-to-face at all.
And of course, all schools in the UK are officially closed from today because of the coronavirus outbreak. Teachers' unions urging parents to send children to school today only if absolutely necessary. So children of key workers, medical staff, police officers, those involved in food distribution, they're still able to attend. And the General Secretary of the National Association of Head Teachers, Paul Whiteman, made this plea to parents.
We are getting reports of an overwhelming demand for places. This was not the plan. The plan was always to care for the very few that have nowhere else to go to help halt the spread of the virus. So my appeal to the parents of these children is, if you're a key worker and you can help them looked after away from school, please do so.
McDonald's is closing all of its 1,270 restaurants in the UK by the end of today. Previously, the fast food giant had closed its seating areas, but had continued to offer takeaway and drive-through services. They want to protect the well-being of staff and customers. That's what they say. They employ about 135,000 people in the UK, the majority of which are zero-hours contracts. They said staff employed directly by the company would receive full pay for their scheduled hours until the 5th of April, but by that time it expects the government's financial aid package to have kicked in, with staff paid 80% of their wages. In other developments, Germany has expanded curbs on social interactions, banning gatherings of more than 2 people. Wow. 2 people. The number of worldwide cases passes 300,000, with more than 13,000 deaths around the world. Elsewhere in Europe, Spain registered 394 deaths from coronavirus yesterday. Italy recorded another 651. And a lot of the last few hours has been dominated by the Olympics news. Japan's Prime Minister Shinzo Abe has now said the Tokyo Games in July may be postponed. That's the first time they've said that, a week after he declared that they would be held without any problem whatsoever. Shortly afterwards, Canada's national team said it would not be sending athletes to Tokyo 2020. Australia then told its athletes to prepare for the Games next year instead in 2021. New Zealand will, in about 48 begin a shutdown of non-essential services. A shutdown has already kicked in for Australia earlier today, and a nationwide curfew has also been imposed in Saudi Arabia, which has seen a spike in cases. This will be in place for 21 days. Thousands of retired medics are answering the government's call, though, to return to work to help with the outbreak. So far, 4,000 nurses and 500 doctors are returning to the NHS. And one thing that I saw from my local community, I live near to St George's Hospital, is that last night when NHS workers left, one of the streets around there applauded them as they left, which is really nice to see on social media.
Very nice indeed. Jason, thank you very much indeed. So we're up to date now with what's happening with the coronavirus around the world. But I want to hear about the effect it's having on you in your local communities. Are you taking this seriously? Because it seems so many are not. 0800 731 2000. I've got a text here that's coming on 81333, putting the word UK up front, the initials UK up front, getting very angry. The government want people to stay at home and distance. When are we going to get out? We have to eat. Hi Petri, I live in London, but I have to drive to Shropshire for a funeral on Thursday, coming back on Sunday, hopefully. Will I face armed roadblocks on the M25 on my return? Or have I seen too many movies? You might have seen too many movies, but we have to wait daily. Things are changing, aren't they? Absolutely every single day, sometimes twice a day. Mark, good morning.
Good morning. Is it Petri, sorry?
Petri, and yeah, it's a difficult name. Just make it up.
No, it's okay. No, I just wasn't too sure. I don't think that's it. I'm actually from Belfast, so I am, and I'm actually a truck driver. Yes, we do need a lockdown. Some parts of Belfast, people are very good, and some parts of Belfast, people are not. It's the same all over the country, Northern Ireland and over in the UK itself as well, as in the mainland. We need a lockdown because what's going to happen is these people don't seem to understand that they're going to die. It's very simple. Some will come through it, some will go through it. I don't know what the stats are on, but they don't realise that it's a serious thing. And if it gets through to their grandparents, their mother, their father, whatever, and basically what they're doing is stopping the people on the forefront. I'm going to make those ill too, like doctors, nurses, warehouse staff, truck drivers like myself. I made a guy cross the border there last night from Ireland over to UK mainland. I made it in Manchester and back home again with a load of goods. Us guys have to keep on going. but we have to be safe in what we do.
Yeah, that's the very good point that you make, isn't it? It's not just even about family. We need key workers like you. We need, we need the clean. You know, this is an interesting. I saw this tweet the other day. It said, you know, a couple of weeks ago, the government were describing these people as unskilled, and now the country relies on drivers, cleaners, you know, all of those people that have been constantly by society sort of made to feel unimportant. Suddenly they are the most important people in the country, yourself included, getting goods to us, moving stuff around.
What I would like to say is that people saying unskilled, I mean, there's a lot of, especially a lot of truck drivers I know, very smart men, but they love doing the job they're doing. And, you know, and we are getting the goods moving up and down the country. What I have found this last 2 weeks, the roads have been great. They've been quieter for us guys on the roads. And we're able to get the A to B far quicker and get this job done and get back home again. You know, but these people need to be off the streets and get equipped themselves with what's actually happening.
But why do you think? I mean, look, every day there is more devastating loss in Italy. I think last night it was over 600 people in one day, we heard. But why is this not connecting, do you think?
I don't know. There's that much social media, and all I see, I don't do Facebook, but sometimes I did do it at one time, and if I get an email from someone, I'm able to click on the Facebook and see what's happening. There's not many people on Facebook saying, these people like Taliban, stop doing it, but they're still doing it. And I think, you know, the world has never seen nothing like this in a long, long time. You know, and it's an unknown killer that's going to just get you, and you don't know it's affecting you until it hits you, and bang, you're out, and that's it, you know.
It's extraordinary. It's extraordinary that I mean, maybe we're just not very good at taking instructions in this country. Maybe, as has been suggested, younger people have never known jeopardy before, so they don't understand this. I don't quite. There's something in the water, though. I mean, there's something about what's going on that people just are not getting. Mark, great to talk to you from Belfast. Do keep in contact and do keep listening to us here. This is the BBC now overnight. We're on 5 Live and all local radio stations, and you're very, very welcome to join in on the conversation. This is your conversation. This is our opportunity as the BBC to connect the country, to hear each other's voices, to talk through this, because there's a lot of people suffering shock and upset and fear. I keep hearing the word terror. People are terrified. So it is a time in our lives which is I've never known anything like it. So we need to be together on this. We need to connect. We need to talk. We need to hear each other. So if you've never phoned a radio station before, don't leave it too long. Get in touch. Join in the conversation. It's your conversation. That's what we're here for. We're here to provide for you. We're here to listen and to talk things through. Just let me know how you're feeling. How are you coping? Are you angry with the government? Are you annoyed that they don't seem that they haven't closed things down yet? Or do you think they're doing the right thing in trusting us as human beings and as adults to do the right thing? Have you witnessed people doing the wrong thing? Do you fear London? Do you fear Londoners because we're the epicentre of this? Or do you think we're all in it together? The whole country's in it together? I'd like to hear your voices from wherever you are this morning, wherever you are in the country. Join in. This is why we've gone nationwide, so we can all talk. We may be isolated in our homes, but we're not isolated. Keep in touch. 0800 731 2000.
And BBC News headlines. The Health Secretary Matt Hancock has acknowledged there have been problems in distributing personal protective equipment to NHS staff in England dealing with the coronavirus pandemic. NHS England says more than 200 health organisations, including all its hospitals, have received new supplies in the last 3 days, and 1 million more face masks are being sent out from today. Teachers' unions have urged parents to send children to school today only if absolutely necessary. All schools in the UK are officially temporarily closed because of the outbreak, but the children of key workers, including medical staff, police officers, and those involved in food distribution, are still able to attend. And trains are running on a reduced timetable across Britain from this morning as many people stay at home. The government has agreed a plan with the rail industry to respond to the fall in passenger numbers, but keep vital services running. And the weather, much of the UK dry with clear skies and sunshine for most. A windier day for Scotland and Northern Ireland. BBC News, next update at 5 o'clock.
Text 81333 and start your message with the letters UK. Text to charge at your standard message rate. See our privacy notice on the BBC website.
A very good morning to you. This is the BBC across all local radio stations and 5 Live. I'm Petrie. Don't worry if you get my name wrong. Most people do. I think even my own mother gets it wrong occasionally. So I wouldn't worry about it, just call. But this is how I explain my name. If you were to introduce a pet to a tree, you go, pet, tree. Right, that's it. That's the best way I can tell you. It's spelt Petrie. Those of you in Scotland will know it as a surname. Hoskin, by the way, is Cornish, and I have many Hoskins down in Cornwall. Huge a number of Hoskins down in Cornwall. So do get in touch. I'd like to hear from you from Land's End to John O'Groats. I mean, from everywhere in the country at the moment about lockdown. Do we need to be told? Are we just not smart enough? Kind enough? What's going on? Why are people not socially distancing? What are they not getting? Maybe you're one of them. Maybe you're somebody who doesn't see the point. I'd like to hear your voice as well this morning. Claire, good morning to you.
Good morning. I have a few quick points I wish to make.
Yes.
Number one, I am blind and have been all my life,
Right.
and deal with other people who have problems. Now, the government are not helping blind people in general. I go to a shop that does not have the computer facility, not that I've got a computer, but for putting things together. So I rely on the staff every week to come round with me and pick up what I want.
Yeah.
Now, if I want stew and dumplings, I have that 1 week, and chicken maybe the next, because they're thin there. And I'm fine, I can broil them when I get home. But a lot of people can't, so that's one problem for blind people living on their own. Number two, it's the travelling. I've had travel up until now, but people say, yes, we will take you when we're going. Now, that doesn't help. The third point I would make before getting onto the government is they keep saying letters will come round and you can have packages delivered, but you've got to know what's in that package. And also, many people are living alone, and most of my friends are well into their 80s. There's no one now to read any print letters. So we should be getting things in braille or by telephone.
Absolutely right.
Just one more point before you carry on. The government does need to lock down, but they do need to find people to help blind people shop. Now, another point on this, yes, there are people that will do it, but they need to be paid. Now, blind people also need to be able to get out to pick up their money from the post office or wherever. So it's all very difficult.
I think, look, I understand blindness. There's a lot of blindness in my family. My grandmother, my uncle, you know, there are people that I grew up with who were completely blind. And so I get it. I understand it. I was brought up with it. And it does seem to be a glaring omission. I hope that it isn't. I hope that they have you registered somewhere and will be paying particular attention to you. If not, well, then we need to get in touch with some of the blind charities and make sure that they know.
Can I come back on this? Yes, I've been registered all my life, but they're so inundated with people with problems, they can't cope. And I personally, who deal with other people, have had people say, yes, you're on our books and we'll try and get someone to help you shop sometime. That's the whole point. No one's actually doing anything. They say at the end of the conversation, take care. And you feel like, well, that's it. But there is no real help out there in general unless you've got a good neighbour.
Yeah.
And when you live in a flat, no garden. And I'm fed up people saying go out in the garden.
Yeah.
Because there is none. Now I'm pretty tough and I'm pretty certain I'll cope. But there are a lot of people out there, and it will get worse, and people will get stress and goodness knows what else.
But have you, I mean, I'm probably teaching you how to suck eggs here, but have you been in touch with the RNIB or any?
The RNIB is the most useless organisation in the world. They haven't got anyone to help in that respect. They will send Braille out within about 10 years. But as I say, it should be being done now, and there should be people ringing around people saying, look, what do you want us to get you? Not say we'll leave a package on the doorstep, which you won't have a clue what's in it.
It's a very good point, and I'm glad you made it. Thank you so much, Claire. You're in Chelmsford in Essex, so if there's anybody listening in Chelmsford at the moment who is a volunteer, can volunteer, just let us know if there's an organisation even that can help Claire. And people like her. So if there is an organisation in Chelmsford that's been set up, particularly to help the vulnerable, please get in touch with us, and we'll let you know about the organisation. Claire, you look after yourself. Thank you very much. I know it sounds like such a trite comment, doesn't it now? She makes some very good points, and that is that we're just learning as we're going along, aren't we? That things. There are people that go, oh yeah, and there's that group of people, or there's those that need help. Rosamond is on the phone now. Rosamond, Kissy Deborah, good morning to you. Sorry to keep you waiting.
Hello, Petri. I don't know whether you remember me.
I do remember you, very much so. Yeah, your daughter died of a respiratory issue, didn't she, in London?
Yes, she did.
Right.
There has to be a lockdown. And it has to be as soon as possible. And woe betide any MP who votes against it. It will come back and haunt them.
But why aren't we getting it? This is what I don't...
Because I have lived through it, remember?
Yeah.
My children and I, we were given 28 months. And we are very, very sad that the people dying are not going to have that time. Everyone knows that we still speak to the respiratory teams in London, and they were confused why so many people were coming in. So I said to them, it's because of the shoppers, because they are all close to each other. So that's what's going on. People are incredibly selfish. We knew about 3 weeks ago that we would have to isolate ourselves, or whatever you want to call it.
Yeah, at least.
And guess what my children said? Anything, Mum, as long as we don't die. Because their sister died in front of them. See, that's the difference. We would do anything, or I would do anything to keep them alive. I'm self-employed. I have no money. I'm not even moaning, Petri. I don't even care. As long as they survive this.
That's all you want.
Yep. And all the respiratory teams as well. We know so many of them, especially myself, because of the work I do. And I pray for them every day. They are normal human beings. They've got families. They've got children. And they're putting their lives on the line. They are expected to treat, this country is expected to treat at least 15,000 people who were as ill as my daughter. They're not going to be able to cope.
And that's the thing, isn't it, Rosamond? We need to keep the NHS, intact. And if we overwhelm it with people who could have just stayed at home, then people will die that may not necessarily have died because they might have been able to get the treatment that they're getting. Look at what's happening in Italy. We need to be sensible, but I just wonder why we're not being sensible. What is it about Brits that we just don't... I don't know, is it because we don't fear anything anymore? We've never been... a lot of young people have never been afraid of anything. Give me your explanation to this. And I'd like to hear what it's like in your part of the country, because I certainly know here in London, it seems like it, certainly over the weekend, which is blisteringly good weather down here, that everyone was out. Everyone was out. Apart from me. I was fixing my vacuum cleaner. I'm very proud of it. Text here says, hi Petri, I'm lucky enough to live on the seafront in Scotland. Yesterday there were streams and streams of people walking past my front door, mostly extended families, all generations. Big groups taking one dog for a walk, cyclists, runners, the list goes on. I think over the years we've lost our sense of collective responsibility. I'm hoping the legacy of this crisis will be that selfishness goes seriously out of fashion. But there's going to be a harsh cost to this lesson, and that's from Darren from Linlithgow this morning. Thank you very much indeed for that. I'm taking your calls. So give me a call, 0800 731 2000. Emergency legislation that would grant powers aimed at tackling the spread of the coronavirus pandemic will be debated by MPs later. Under the proposals, airports could be shut and police would be able to force people with virus symptoms to isolate. The powers, which would be time limited for 2 years, are expected to be approved by MPs. Let's speak now to BBC's Simon Jones. Good morning to you, Simon.
Morning.
We've been talking this morning across the country about the fact that we don't seem to be obeying the advice. Do we now need to be told what to do?
Well, the Prime Minister is threatening further measures to limit people's movements if they continue to ignore that formal advice on social distancing to stop coronavirus spreading. Now, the advice, as we should all know, is that we should really stay at home if we can, or if we need to go out, for example, to exercise, then we're told we need to stay more than 2 metres away from other people. And the things you've been talking about, the scenes we've seen during the weekend with the sun out, show that a lot of people weren't doing that. A lot of people headed down to the coast. There were packed scenes around fish and chip shops. A lot of people headed to parks in places like London, and they seemed overwhelmed by visitors, and that's led to this warning that a formal lockdown could follow. Now, in his news conference yesterday, the Prime Minister said, don't think that fresh air in itself automatically provides you with some sort of immunity. Even if you think you're invulnerable, there are plenty of people you can infect whose lives will then be put at risk. And overnight, the government has changed its travel advice. Now, it's urged people not to travel to their second homes, if they're lucky enough to have one of those, not to travel to any caravan parks or campsites, to isolate themselves, or to go on holiday, because there are real concerns that additional pressure is being put on local communities and services which might not be able to cope. And what Boris Johnson was saying has been echoed by Scottish ministers. They've criticised what they're calling reckless and irresponsible behaviour which is endangering lives. And the Welsh Government too says if people don't follow the advice, then they'll use powers to make them follow it.
So we're going to wait today. Many people are expecting the Prime Minister to get tougher today when he does his daily briefing. So we'll have to wait and see if indeed he is going to go further with that. But there's also been an issue, hasn't there, with NHS. They're calling a lot of retired NHS nurses and doctors back to the fold. Some of these are concerned that they won't have the protective gear. There seems to have been a problem in the supply chain of this, but that is changing today.
Yeah, it's not just NHS staff who've recently left the profession who are coming back who are worried. It's existing staff who are saying they're on the front line and they simply don't have the protective equipment that they believe that they need. Now, the Health Secretary, Matt Hancock, has acknowledged this morning that there have been problems in distributing this personal protective equipment to NHS staff in England who are dealing with the pandemic. He says he's determined to get the right kit to the right people. Now, NHS England have told us that more than 200 health organisations, including all its hospitals, plus care homes, hospices, GPs, practices and ambulance trusts, have received fresh supplies in the past 3 days. And they've told us this morning they've just bought 1 million more face masks. And the army is now helping to manage and to distribute supplies. And the reason this is necessary is that we've had a very stark warning from the Doctors Association. They said that their members have become increasingly concerned that the lack of appropriate equipment would put them at risk, they'd put other patients at risk too without immediate action. And they warn that NHS staff could lose their lives. And the Doctors Association chairman said doctors had told them they felt like lambs to the slaughter.
Yes, I saw that. Another one describing themselves as cannon fodder, which is deeply troubling. The stores, some stores are making the decision themselves to close. They're not waiting for government. We know that pubs and gyms and leisure centres and restaurants were asked to close on Friday and to not reopen, but other stores now are making a decision. I believe that Primark has decided to close all of its stores, and McDonald's too.
Yeah, Primark, McDonald's, Nando's. Now this is to try to stop people gathering, so the stores themselves have decided to shut, and I think for some of them it's partly as well due to the massive drop in footfall with people simply not coming into city centres and town centres. Now, McDonald's, for example, have said by the end of today it's going to shut all of its stores. It's got more than 1,000 in the UK. Now, for the past few days it had been offering a takeaway service because that was permitted under the latest government rules, but now it says for the safety of its staff and its customers that has to stop too. And I think we're seeing an increasing number of shops making that decision themselves before potentially they could be forced to do that by the government.
And finally, and briefly if we can, schools and trains. Schools are meant to be closed, but a lot of people are trying to sneak their children into school.
Yes, and teachers' unions are urging parents to send children to school today only if absolutely necessary. All schools across the UK are officially closed, but the children of key workers like medical staff, police officers, those involved in food distribution are still able to attend. Head teachers, though, worried schools could be overstretched. In terms of rail, trains are running on a reduced timetable across Britain from this morning. Three main reasons for that. There's been a reduction in passenger numbers of up to around 70% on some routes. They also want to send out a message: please don't use the railway unless you absolutely have to. You should be staying at home if you can possibly work from home, or if you don't need to go out. And they also want to keep services going because inevitably they will face a problem with staff being unable to work because they're sick or looking after family members.
Good to talk to you this morning. Thank you very much indeed. BBC's Simon Jones there, bringing us the very latest on what the government is doing. We'll wait and see what Boris Johnson says today. But I'm asking you, are you frustrated that he hasn't put us all into lockdown? Do we need to be forced to behave? I know in London people are still seemingly going about their normal lives. I was locked in my house this weekend, as I said earlier. I kicked my son out. Well, I didn't kick him out. He's staying at a friend's house because he went to a party on Thursday. I mean, he's 22 years old. They think they're invincible, don't they? So I've said, no, you can't. You go and stay with your friend who you went to the party with. Give me a call, 0800 731 2000. Wherever you are in the country, I want to know how people are behaving. I want to know what they're doing in your area. Let's talk to Russ, who's in Staffordshire this morning. Good morning, Russ.
Good morning, Patrick. Thank you for taking my call. Pleasure to speak to you for the first time.
It's lovely to talk to you as well. Thank you for picking up the phone. Tell me, what is it that's worrying you at the moment? I mean, are we behaving badly?
Definitely. Words I couldn't possibly say on national radio, but I'm feeling the pain. I'm feeling the anger and disappointment that I think I wasn't feeling. I'm still working. I'm one of the proportion of the country that's taking this extremely seriously. You just mentioned your son. I think that's the problem with a lot of young people.
Yeah.
They probably are most of them are invincible to this. They might not feel any major symptoms, mostly. I know obviously there are young people suffering from it, but that's not the point. It's us older ones. I mean, I'm 44. I'm 44. Sadly, I'm home to sort of accept and realising that I'm not a young spring chicken anymore. But I work in the private security sector, and I heard you talking about workers that have suddenly become valued. The private security sector has always been pretty undervalued by government, by society in general over the years. The pay tends to reflect that usually. But I was actually surprised to find out that we're not included on this key workers list.
Really?
Which seems odd because we're protecting people's property. I look after a very large business park, and crime is quite bad of late, off and on and around the business park. Obviously, police are scarce nowadays because of numbers. The military isn't what it once was. And I actually think that maybe that could be why the government's reluctant to put the military on the streets, because if the military catch it, they tended to be billeted together or based together. It'd spread like wildfire. I mean,
security workers are going to become more and more important, aren't they?
They already are. Supermarkets, all supermarkets now are having 2 security officers instead of 1.
Yeah.
And there's a sudden national desperation to employ retail security officers, and because the wages are not that good, they're struggling to get them. And if the police come down in large numbers with this virus, and then you start getting the military guys as well, we'll naturally always be the last resort. Who they're going to ask? Because at the end of the day, I'm licensed by the Home Office.
Yeah.
My SA licence, I'm registered with the Home Office. So the government have got access to all of us, and at some point, I'm sure they'll want to use us as a last resort.
Well, not even as a last resort. Come on, let's be reasonable. Oxford Street, for example, here, or the shopping centres around the country, or shopping high streets, they're going to need people on them, because if nobody's there, that's when criminals come out to play, isn't it? So.
Well, it's like this. Where I work now, I mean, if things progress, which they probably are in terms of this virus, I hope I'm wrong, obviously, but, it will affect law and order to a point, and people's businesses, a lot of these businesses may go into sort of temporary shutdown because of this, and there's businesses with a lot of assets stored in these units, and we're the only, sort of front line against the crime, and the police quite possibly could be dealing with idiots who don't want to follow the guidance.
Yeah, I think it could be right, Russ. It's all of these things every single day, every time I have a conversation, it opens my eyes to yet another layer, another ripple effect to this virus. Russ, take care. Thank you very much indeed for calling in. Peter has called from Bath. Good morning, Peter.
All right.
Morning. What are you up to this morning?
I'm driving a truck for the co-op.
Right. Key worker, important work.
Well, I wouldn't say it was important, but I think the NHS do a better job than we do.
Well, even the NHS need to eat. So thank you for continuing to work. Why do you think it is that people are, a lot of people are ignoring the idea of social distancing and isolation?
I find people very selfish in this country, and I also find that nothing happens to people unless it happens to them. If they lost a loved one or somebody they knew, that's when it'll actually hit home that something is actually happening.
But I mean, the news is there. We can see what's happening in Italy. It's something more than that, isn't it?
Yeah, but we're in a culture that'll never happen to us. That's what they think until it actually happens. I was out yesterday just in my car to get some fuel, and it was lovely to see families walking about and doing things like that in the nice weather. And they never did that before this happened. It's like if you got told to go out, everybody would stay in. This is the culture we live in.
You could be right. You could be right, to be fair. I mean, there was some reporting suggesting that people were out in such large numbers at the weekend because they were worried that a lockdown was coming, thereby potentially causing a lockdown. So the irony of that a lot of people have been out and about because of that. It's extraordinary times. Peter, good to talk to you. Thank you. 0800 731 2000. I've got a text here, which is a very good point, actually, and I was talking about this last week before you guys joined us. Can you warn people who rely on these neighbourhood groups that are popping up that they shouldn't hand over the cash or their card and PIN number just to anyone who knocks on their door and says they'll get shopping for them? Also, we've raised the last 3 generations to know their human rights, and teachers get abused from parents if they tell misbehaving children off. Is any wonder that no one is doing as they're asked by the government? So, we're not doing what we're asked to do, so do we have to be told? Do we have to be put into lockdown? What's happening in your area? I know what's happening in London. A lot of people are flouting it. A lot of people are just going about their business, enjoying themselves. I thought it was better around the country, but from what I'm hearing this morning, it isn't. So I want to hear about you in your area. 0800 731 2000. Nick, oh, by the way, the call's free. Just, I meant to mention that earlier. The call's free, and we call you back anyway. So it won't cost you a penny. Just get in touch. Nick, good morning.
Good morning.
Nick is in Romford this morning. Tell me, why do you think we're not paying attention?
As your last caller said, we've got that culture that people don't seem to take things seriously until it's happening to them. It's a sad state of affairs, but we are quite ignorant, us Brits, when it comes to being told what to do, what we can and can't do. So I think it's inevitable we will end up in a lockdown.
It's so bizarre to me that because people have complained about the nanny state for years, right? That the nanny state tells us how to do everything, from bringing up our children to walking the dog. And so we would listen to them, but we're not listening to this now.
Well, again, it's probably fear as well. I think fear is playing probably a part of it. People are worried about what's about to come, so they're taking the last few minutes that they can to go out there and get that bit of freedom.
But why have people been gathering in Primark? I mean, you would think that you don't need to be, particularly if you're going to spend the next weeks or so locked in your house, you don't need to go and buy that new cardigan.
Retail therapy is amazing, isn't it? It does things for people. Even faced with the problems we've got now.
I just don't understand it. You're worried, but you run a security firm.
I do, yes.
And what's worrying you?
Well, part of what I do is attend alarm call-outs, mobile patrols. So every night I have a team of people that drive up and down the A13, the A12, the A10 in Essex, Edmonton, East London, responding to alarm call-outs where people's alarms have been activated. We go and do checks on properties to make sure gates are secure, there aren't intruders or unwanted trespassers on the sites, that sort of stuff. And if we go into a lockdown, we need to be sure that we'll still be able to conduct the services we provide. Now, it's not just a matter of keeping people employed, it's a matter of keeping people's security and their properties and their premises secure. And from what I understand at the moment is, although the police are obviously classed as key workers, and you've got distribution drivers classed as key workers, which they rightly should be, surely security people should be classed as key workers.
It's just so interesting, because of course we're just talking to Russ and he's saying the same thing, and it does seem that there are gaps in this key worker list. Nick, good to talk to you. Thank you very much indeed for that. Listen, the conversation is continuing this morning, so please do get in touch. Pick up the phone, 0800 731 2000. It won't cost you a bean, and we'll call you back. You can also text. I'm going to say a goodbye to 5 Live, but stick with us on all local radio stations. Well, across BBC Local Radio, I'm Petrie Hostin with the news at 6 o'clock. Here's Matt Schofield.
The Health Secretary has acknowledged there have been problems distributing personal protective equipment to NHS staff in England. NHS England says more than 200 organisations, including all its hospitals, have received new supplies in the last 3 days, and 1 million more face masks are being sent out from today. Matt Hancock says he's determined to get the right kit to the right people.
I take very seriously my responsibility as Secretary of State to make sure that everybody working in the NHS across social care is safe, and for that they need the right equipment. And I'm listening very carefully when I hear that there's a problem on the front line, and then trying to get in there and fix it.
MPs are expected to approve emergency legislation that would give the police powers to force people showing symptoms of coronavirus into isolation. The powers, which would be time limited for 2 years, could also lead to airports being shut down. Boris Johnson's warned it may well be necessary to bring in tougher measures to enforce social distancing after many parks, rural areas and seaside resorts saw large increases in visitor numbers over the weekend. Parents are being told to keep their children at home unless it's absolutely necessary, as schools across the UK close to most pupils. Those who are vulnerable or the children of people classed as key workers can still attend, but the leader of the National Association of Head Teachers, Paul Whiteman, has warned staff members will be much depleted.
We are getting reports of an overwhelming demand for places. This was not the plan. The plan was always to care for the very few that have nowhere else to go to help halt the spread of the virus. So my appeal to the parents of these children is, if you're a key worker and you can have them looked after away from school, please do so.
Revised train timetables come into force across the country this morning as operators respond to a fall in passenger numbers. Core services will continue to ensure those who need to get to work can. Canada says it won't send a team to the Olympics in Japan this summer as pressure grows on the organisers to postpone them. The Japanese Prime Minister Shinzo Abe has conceded for the first time that it might be necessary to delay the Games, which are due to begin in July. The BBC's Rupert Wingfield-Hayes is following the story in Tokyo.
This could start a chain reaction, and Prime Minister Abe this morning in Parliament said a postponement is under consideration if the Games can't be held safely, and that he'd been discussing that with the IOC over the weekend, but he said no decision will be made for 4 weeks from now, and the governor of Tokyo has come out and said the same thing. 4 weeks until a decision is made.
The weather, after a cold start, it'll be dry again with plenty of sunshine. BBC News, it's 3 minutes past 5.
The Queen has issued a statement. No one will be more conscious than the Queen of the importance of the role of the royal family now as a unifying figure, kind of a role to play to try and help us get through this staggeringly difficult time. We're going to have moments where you can call in, get all your questions answered. A question too basic.
We are facing an economic emergency as well as a health one.
Cash flow is obviously the lifeblood to local businesses.
Please be reasonable in your shopping. Be considerate and thoughtful of others as you do it.
So many scientists are working so hard on this, and many of those scientists at the front line are UK scientists as well.
Follow our coronavirus coverage on digital, BBC Sounds and smart speaker.
This is 5 Live, across the UK.
This is BBC 5 Live. Wake up to money from BBC 5 Live.
Hello, a very good morning to you. Don't worry, you haven't slept in. This is Wake Up to Money. We're on at the slightly earlier time of 4 minutes past 5 this morning. Coronavirus changing everything at the minute, and in the next hour it will dominate again what we're discussing. How much shutting up shop will be enough? At the weekend, bars and restaurants were closed, but plenty headed elsewhere.
Levels of people that I haven't seen in my 30-year career. This is on August bank holiday.
Boris Johnson warning of stricter controls as well that could come if people didn't keep their social distance. No drive-thrus, takeouts, deliveries from McDonald's now as the chain closes its UK stores. Others in the restaurant trade have switched to takeaways to try and cope with the collapse in business.
Since Monday's announcement to avoid all restaurants, we've had less than 10 customers come through the door.
Now, another thing the Prime Minister spoke about, some say confusingly, was about our need for exercise. Gyms are closed as well. We've got the boss of Pure Gym live on the show to tell us how he's planning on keeping his business going. And one option for some companies is the government's emergency loan scheme. It launches today, starting early this week, we're told, with the British Business Bank taking charge. Its chief executive will explain to us how it all works.
Wake up to money with Sean Farrington.